myth or fact? Everyone who goes for therapy must be on medication. What is your take about that?
Okay. Now, this whole pandemic has brought, a lot of mental health issues. It has dramatically impacted people's mental health and behavior. So when we talk about mental health services, yes, there is a, broad spectrum there. You're talking about normal counseling services. You're talking about therapy from a clinical psychologist, which is slightly different from the counseling services. And then you have a psychiatrist. So first, I think we just, I'll take a minute to explain. So you got a psychiatrist who is a doctor and, is able to not only counsel you, but also able to give you medication if required. So the psychiatrist is the one who actually does the diagnosis. Now, few psychiatrists only do the medication part, but some of them who are keen into it also do the counseling, and I'm one of them. Now, maybe a psychiatrist can't do all types of counseling because, psychology and clinical psychology, it's a proper degree, and obviously they take years into doing that. So you have clinical psychologists who are able to do the assessments and are able to complement the diagnostic part for the ones who require it. They are able to do personality assessments. They are able to give you therapy. Again, there are different kinds of therapy like CBT, cognitive behavioral therapy, which might be used in terms of anxiety, grief, OCD, and so on. There are psychodynamic therapy, which are longer kind of therapy. It helps people who've had, say, issues from childhood and attachment issues or abuse, or lots of things, trauma and all in their life, and that has impacted in their personality later on. And then third comes just the counselor or the counseling services. Now, when people do these counseling degrees, they can either choose to do general counseling or they can specialize into different ones. So some counselors might choose to work with schools and colleges. So it's more of educational, counselors or supportive counselors there. Others might choose particular topic, like maybe they want to work with women or, with children or with the elderly population, so on. So I just wanted you to understand how, the framework works. So your question was about therapy. Yeah. So everyone who must go for therapy must be on medication? No. Although I am a consultant psychiatrist trained from the UK and also working in India now, I'm of the view that when someone has an issue, first we have to put effort into trying to manage it with a non-medical intervention if required, if possible. So something like counseling, depression, stress, grief and all, I would suggest going for counseling services first. So when we talk about therapy, it's any kind of counseling that we discuss. However, now who decides whether it is therapy or medication or so? So the initial assessment needs to always happen through a psychiatrist. They can then formulate and tell you, well, this person can manage just by counseling. We don't need medication at this point, in which case they refer them to counseling. Again, it is very personalized, isn't it? With COVID, we are seeing a lot of people struggling. So it could be that there's been a loss in the family, there's been a bereavement and family is really struggling. So their counseling is going to be slightly different from someone, say, who's had COVID and has now developed this extreme anxiety about their own health and a fear of death, and also their counseling is going to be different. So my answer is therapy doesn't always have to be with medication, but there are a lot of conditions within the mental health where medication and therapy are done together. So we'll come to it when we talk about those conditions.